Have you ever experienced the flu or trangkaso or had COVID-like symptoms, but when you get tested, results turn out to be negative? So what do you do now? Well, one of these symptoms is having a cough. Now, this morning, we'll talk to a pulmonologist about the signs, the symptoms, causes, and proper treatment for cough. Joining us now via Zoom is Dr. Gilly Santiago-Europa. Good morning and welcome to New Day, Dr. Gilly.
Yes, good morning, Dr. Freddy. Good morning.
Thank you for joining us. Now, Doc, I know some people who are experiencing prolonged cough, but not as a symptom of COVID-19. Now, tell us, Doc, what's usually causing itong ubo na to? Kasi usually kapag merong umubo, feeling nila may sakit na kaagad sila. Bacteria and virus lang ba ang sanhi ng cough?
Yes, actually, the first thing that you have to consider if the patient is complaining of cough is the duration, no? So yun yung una namin tinatanong sa pasyente, gano'n nakatagal, all right? Because we classify cough into acute, subacute, and chronic. So kapag acute, no, yan yung less than 3 weeks. That's very common in the past weeks and months after the holidays, no? So usually mga few days to a week or 2 weeks. So more than 50% of the time, it's actually respiratory tract infection. And the cause of the respiratory tract infection is actually mostly viral. All right.
Okay.
So we always tell that to our patients.
Yes, that's good to know. Now, Doctora, is it possible to have a cough, to experience cough because of nagpapalit-palit yung weather from cold season to summertime and vice versa?
Yeah, yes, agreed. That's a common question actually, no. The change in temperature, no, from cold to warm, no, temperature is actually a trigger for allergies, no, especially those patients that are established asthma. No, it's one of the trigger of asthma. That's why a lot of our patients recently were getting a lot of asthma exacerbations, no, because of the change in weather. Because change in temperature and weather can actually be a trigger for what we call allergic airway.
Okay. Now, Doktora, the important question here is kailan ba dapat tayo magpatingin sa doktor, magpa-check up? Kasi marami sa atin, kapag may ubo, susubukan mag-home remedy, kakayanin hanggat sa kaya. What are some of the red flags that should signify that it's time to see a professional, a doctor?
Yes. So, of course, with this pandemic, sanay na tayo sa ubo, no? So, medyo nasanay na talaga tayo sa ubo. But of course, the red flags, no, that's the second thing that we have to consider in evaluation of cough, no, as a doctor or pulmonologist, are the red flags, no? So, yung fever, number 1, is prolonged, no? Sometimes, of course, if it's a viral respiratory tract infection, may kasama talagang fever. But if you know that the fever is prolonged or recurrent, number 1. Number 2, there are signs of dyspnea or hingal, no? Shortness of breath or chest pain pag umuubo. All right, because that could be a sign of pneumonia. Yan ayaw natin. Third is hemoptysis. Pag may blood sa phlegma or sa sputum. All right, and then other significant features like yun nga, may chest pain, may mga vomiting. So there are other new associated features to the cough. So we have to seek our doctors immediately if we have those.
Now, Doc, what's the usual duration ba ng cough? Should it disappear after a few days? Pagkatapos uminom ng gamot? Others kasi parang it doesn't go away kahit ilang linggo na.
Yes. Usually, if it's a viral respiratory tract infection, 1 week or less, in a few days, it will resolve on its own, no? Because we have our immune system to work to address that, all right? So if it goes beyond 1 week, 2 weeks, and of course, yung ayaw natin more than 3 weeks to 4 weeks, no? Chronic na matagal na yon. Of course, that's alarming already.
Okay, thank you very much once again, Doc Gilly, for joining us this morning here on New Day.